That's a great question, you know, and I see that a lot in my practice. I see people coming in and they're confused. And they have, like, you know, a bunch of medications. They have a set of blood test results. It's usually like 1 page or maybe 2, which I consider insufficient to really find out what's going on with somebody. They're tired, their gut's not working, they're depressed, they're just not feeling right. The regular doctor says there's nothing wrong with you because their blood test looks all fine. And they're here in my office, and they're looking for help, they're looking for assistance, they're looking for a solution. And so what I do is I get really curious. I spend an hour to an hour and a half with somebody, not 10 or 15 minutes. You can't get to know somebody in 10, 15 minutes. You even can't get to know them in an hour and a half, but you can do a lot more. I get really curious about them. I start asking them about their life and about their symptoms, and I look back in their history to see how these things may have developed. And a picture starts to form, you know, of like some incidents and some things that may have happened to them that kind of like change the direction of their life in terms of their health and their well-being, and kind of got them off the track. And then we do some very specific testing to find out how the different systems of their body are working, you know, and I send them home with a little to-do list of tests to take, some things to do at home, some things to do at the lab. And when I get all that information back, we sit down again and I lay it all out right on the desk, and I have them sit right next to me, and we're side to side looking at what their body is telling us is going on. And as we look at it together, my light bulbs have already gone off. I already have a really good idea of what's going on, but I see the lights start to come on in them, and they're going, oh, there is something that's not working right. There is something that's off. And I say, yeah, you know, and the good news is we can begin to fix that. We can fix it right now without drugs or surgery. You know, not everything, but many of the things that I treat in the office are fixable, you know, or preventable, or that we can slow the progression of, you know, by doing this kind of system. So my clients walk away with a plan of action, of something to do besides take medication. Maybe like better sleep, and maybe some dietary changes and some exercise, and maybe a few bottles of targeted specialized nutritional supplements, very high level, that are going to like fix those metabolic, you know, problems. And then we follow up, and what I see is that people start getting better. And as they start getting better, they start getting curious again about what's next for them. It's like, wow, okay, now what am I going to be doing with my life? And from that point, we have deeper conversations for those that want it. Then we have coaching conversations. But in terms of the health and vitality, it's like those people that come in at their wits' end and full of confusion and doubt that they're ever going to get better, or that they can take their health to the next level, now have some kind of understanding, you know, of what's going on and what they need. So I'm honored that those folks come in, and that I'm able to sit side by side and work with them as their partner to help them get to where they want to go.